Thank you, Dr. Sandy Gupta. It was very enlightening, and it was very funny and very thorough. Well, we open for questions, maybe a few questions. We have 5 minutes or 10 minutes? 5 to 10 minutes. Please state your name and your organizations. Anybody? I think maybe your presentation is very thorough. No more questions? Okay.
I'm Mukesh Sinha from India, Madhya Pradesh. You see, lots of alternatives are coming in the market, like chewing gum, other products are coming. Have you done any study related to these products? They always do advertisement that if you use this, you can stop the smoking. This is healthier, this is very helpful for your health. Any study, anything?
So the question, I understand, is out there, lots of companies are producing aids to stop smoking. Yes? Patches, chewing gum, etc. Yeah? Stop smoking. So the big studies have done work with bupropion, it's a tablet, with NRT, nicotine replacement, whether it's chewing gum or patches, and with Champix, and then with just counseling. So 4 interventions in that sort of grouping, and they've all been effective to some extent. But the maximum return is only 20 to 30% quit rate. That's what the reality is. And remember what that slide of people often need 5 or 6 goes to stop smoking. My understanding is of all the leaders in pharmacotherapy, it's varenicline, the Champix, the course of medication, but only in the right patients with the right support, but it is costly. That may be the most effective way. I don't have much data on the other sort of local brands of ingredients to help stop smoking though. Yeah.
Thank you very much. It's really
Just about, yeah.
Thank you very much. It's really wonderful presentation, and
Thank
really
you.
enjoyed and learned a lot.
Will you make sure you write good feedback, by the way? Yeah?
And I have, it's not a question, it's like an opinion that when you talk about the quitting, when someone wants to stop,
yes.
that, in your presentation that you wanted to tell something that we have to use some kind of medicine or like therapies. But I am Sampath from Sri Lanka, representing ADIC, Alcohol and Drug Information Center, that we work with a lot of smokers, especially in the military area, militaries and the police. And we do have experience that we have worked with them, and we could able to stop their smoking without any kind of prescriptions, any therapies. And therefore that, I do believe that therapies can work, but without those kind of medications, and we can do more.
I think that's a very valid point. And you will often hear people who either an uncle or a grandmother or a cousin have died from smoking, and they stop themselves. So you're right that people will, if they're disciplined and motivated, or they have a shock, will in some scenarios. But I think people need to be given all the options, that if your own strategy doesn't work, we have plan B. All I want to say is that why do you want to wait till your heart attack or your stroke to stop smoking, eat properly, and walk more? Why do we only do it when we have the event? That's human nature. And often people think, it's not going to happen to me. And this is what we have to be encouraging at a young group. And the thing about the military, not only are they more disciplined, but they are often young. So remember that picture of the brain. Maybe the addiction hasn't kicked in like someone who smoked for 50 years. They are the ones often that are a bit resistant to just stopping smoking by their own means. Rakesh.
So, Sandeep, great presentation.
Thank you.
And what is your own opinion? The National Health Scheme has allowed e-cigarettes for cessation. And but what is your own opinion about it?
So the question is, in the UK, some of our health organizations have given freedom for e-cigarettes. I do not mind, in terms of my own opinion, that if you're a heavy smoker and you stop cigarettes, tobacco, and you go onto e-cigarettes, fine. Perhaps they have less of the carcinogenics, but only go to e-cigarettes as a tool to eventually stop e-cigarettes as well. It's the stepping stone. What I am worried about is the group of teenagers who are finding it trendy and sexy to smoke e-cigarettes, and they've never smoked before. And also the worry that if you take e-cigarettes, you're more likely to try cigarette smoking. So the third issue is the battle of new data of e-cigarettes blowing in your back pocket, blowing up, and also causing lung irritation, and we don't have long-term data. So I'm a bit hesitant, and only a small group, the heavily addicted, I would encourage.
Thank you.
Thanks. Is there one more question?
Yeah.
Ah.
Enjoyed your lecture, Dr. Gupta.
Thank you.
That was mostly you referred to cigarette smoking, and that's of course quite logical.
Yeah.
There is most evidence and most problem with cigarette smoking. But in this part of the world, as we all know, in addition to cigarette smoking, there are many other forms of tobacco use. You did refer in passing to tobacco chewing also, but how do you see it as an overall tobacco problem, and your experience, do you have experience with non-cigarette form in UK, because it is a multicultural, lot of immigrant population there?
Good point. You're right that if you look at evidence-based and epidemiological, it's mainly with cigarettes. But in the UK, we have a Middle Eastern population with shisha, heavily concentrated tobacco. We have a group of population in East London, Bangladeshi, and they say 25% of Bangladeshi women are chewing tobacco. So we've got limited interventions, but the point is, the message is clear that they not only all contain nicotine, but they are all addictive and have tobacco with harmful carcinogens. So my view is to treat them as one group rather than prioritize cigarettes more than betel nut or snus or whatever. I think probably next speaker. Yeah, okay.
Thank you, Dr. Sandy Gupta. I think do you want to have one more? Okay, so this will be the last questions because Dr. Sandy Gupta has to go to the airport.
Assalamu alaikum wa rahmatullahi wa barakatuh. May God's blessing and peace be with you. Mustafa Ma from Malaysia. As you know, the world's biggest pharmaceutical companies are only interested in producing maintenance drugs. Seldom do we see any drugs that are aimed at curative. So what are the cardiologists' position on this issue? Because they want to maintain the patient for 10 years, 20 years, 30 years, 40 years. But seldom do we see pharmaceuticals that are aimed to cure. Thank you.
I think that's a separate lecture, but I think you make a valid point. And this is why I've always said, cardiologists, we never cure anyone from coronary disease. They all come back. Bill Clinton had a bypass. in 2010. 5 years later, he needed a stent. Disease progression. So essentially saying that whether you're on the major pharmacotherapies for coronary disease, you can only reduce by 20 to 30%. We will never go to 0%. It's not like a course of antibiotics. And even with smoking cessation, don't think, although the companies may make these products to stop smoking, they are realistic, that only 20 to 30% reduction and quit rate, which is better, however, than the 5% without support. So I think it's a valid point, and we haven't got cure for everything yet. Thank you very much for your time.